How you like my green background? How you like my green background?
I like it. Soothing.
Yeah.
Soothing.
How you doing, gang?
What's up, bro? How are
You
you,
know,
man?
this green background remind me of Dr. Seuss with Jim Carrey.
Yes. Yes, it does, man. It does. That was actually I think everybody's favorite books when we were little kids.
My
Really, I
favorite
think.
my favorite book when I was in the first grade was Encyclopedia Britannica. That was my favorite book.
Oh wow.
Encyclopedia Brown.
Yeah. Encyclopedia what?
Encyclopedia Brown.
Encyclopedia Brown. That's he said.
No, Britannica,
Yeah, I guess
the actual, because I
the
never
real
knew
one.
what the, no, I never knew what the hell I was reading, but I could get all the volumes and I could climb up and go get my cookies out of the cupboard. That's why I liked it so much.
You it was so bizarre, yeah, because everybody relied on the
Yeah,
Encyclopedia Britannica, and even if it was 10 years old, people were still using Encyclopedia
yep,
Britannica for their
yep,
research,
What is that?
yep.
and most of the stuff was outdated already,
And I love my parents so much. I miss my dad, but one of the first things he got me, and we weren't well off to do growing up, but they
on
saved up.
laptop.
No, they got me one of those small, those metal globes of the world
Oh yeah, yeah, the
on the
globe, yeah.
stand.
I had that. I had that.
That's it. Had that.
Oh man, I used to just love looking at it. I mean, it was okay to dream, eh? One day, one day. But how was
Well,
your day today, brother? How was your day?
good, good, good. I'm not seeing any comments. I don't know why. I'm not showing any comments on my.
Can't wait.
I'm not sure why. Maybe we get 128 people on already. My gosh, but I'm for some reason I'm not seeing any comments. But anyway, maybe everybody's.
So
What you get? How come it's not showing up on this
just
thing?
just push them on the side.
I did, I
Really?
did. Yeah. Okay,
Yeah, I
there we
get
go.
21 comments. Yeah.
Okay, now it's up. Now it's up. All right.
See? See?
Patsy's, where's my room spray? Terrence is asking.
Huh. Patient.
Well, everybody, welcome tonight. I know we got on a little bit late. Charlie and I was having a little discussion, but offline. But anyway, you guys heard the news. You heard the news tonight. Today, 5 more cases on Kauai. I'm gonna leave it there because tonight we have, and it's a coincidence. I believe nothing happens by accident. But tonight we have the mayor, Derek Kawakami, and Dr. Janet Berreman from the State Department of Health. She's our district health officer, and they're on tonight. They'll be on at 7, and they'll be able to answer all the questions that you have. We're gonna basically turn it over to them. So I don't know how many of your questions we can get to, but we will be monitoring and try to get as many of your questions as answered. But again, 5 more cases today. This is in addition to what the state reported. I know a lot of you uh, were posting about why Honolulu said only one, because again, as we've said in the last few nights, the state issues their report, and there's actually a end time that all the data, and then they put that out. On Kauai, our mayor and his team does a press release as soon as they get their data, and so our information is current, and that 5 that you saw today will be reflected in tomorrow's state report. So, but that's not the point. The point is we had 5 more cases today. We had travel related cases today. We had people that tested positive after they took a test on the mainland, and they got the results after they arrived. But anyway, we'll let the mayor and Dr. Behrman talk about how the reporting is done and what Kauai is doing. I think now we got to start thinking about where do we go from here. If we continue on this path with these new cases every day, at what point do we start putting in the restrictions? At what point? Yeah, if you watch the news tonight across the country, my daughter's birthday today, Nicole. It's her 25th birthday. And I called her early in the morning, and she said, what a bummer. They just found out last night that their county is on lockdown. Uh, huh?
For 2 weeks, huh?
Yeah, for 2 weeks for now. But anyway, um, gosh, I lost my train of thought now.
Yeah. No, no, no.
But anyway,
He's
across
talking
the
about.
country now, many states. and many counties and cities are going full lockdown. In fact, a lot of the experts are now getting really, really concerned that this virus has gotten away, has run away, and it's going to be very difficult to. What is that noise? It's going to be very difficult to corral this thing. So, Derek and the other mayors, as well as our governor, lieutenant governor, they're in a pickle right now because some tough decisions are going to have to be made if these numbers aren't handled. So,
Well, I would like to say that I think going forward, we know there are some deficiencies. Okay, it played out in front of all of us, and like I've said to many of you out there, from day one, you have ridden this roller coaster ride with us, so you're just as bright as we are, and you're just as akamai with the issues, and that's why many of you have argued, just give us the number, because we all want to take stock in our health and safety, and we want to follow along. So I guess the plan is now is when we go forward, we're going to have to be very conscious about the information and how do we use it to help to take care of ourselves. That's what it's all about. That's what it's all about. And there he is. Hello, Mr. Mayor.
Hello. Am I on mute? No, I'm not.
No,
we got you, buddy. We got you.
Yeah, we got you. We got you.
How are you, sir? Thank you for joining us tonight. And I know
Absolutely.
we're waiting for Dr. Berreman to come on. We've been waiting for this night for a long time, to be honest. We only built the courage to ask you a few nights ago, though. So,
You
we
guys,
know you guys have been so busy, Derek, and
Yeah.
we basically we talk about it every night. People when Dr. Berreman comes on, you guys can do your thing, but one of the bigger concerns right now from a lot of people is the reporting. Why is, how come we get 5 and the report only said 1, and I just try to explain it, but I said, oh, here comes Dr. Berreman. Awesome.
Yep. She can answer that because I get confused too. But from what I understand, the product we're getting is going to be a lot more detailed too. So identifying clusters. So I think with the change in leadership, and I got to say, Dr. Char is the right person to lead the Department of Health, at least in my opinion, and the opinion of others. So this might be just a pivot in operation. But Dr. B is here.
Yay.
Hi,
right.
sorry.
So real quick, if I know most of you know that Mayor Kawakami, Derek Kawakami, and then of course Dr. Janet Berreman, our State District Health Officer here on Kauai. Thank you both for joining us tonight at a time where I think there's a lot of tension, stress, concern from the public with the rising numbers, especially here on Kauai. But we do have viewers from across the state, and one of the things, and we'll turn it over to you folks, Doctor, and you can pretty much give us all the briefing. But one of the things I was just sharing with the mayor was that a lot of the concern is about reporting, consistent reporting throughout the state. How come Kauai's numbers are different? We tell them because we're very transparent, and our county elects to put out a press release whenever they have the information all put together, validated, verified, boom, they shoot it out regardless of the time. And I think that's why. So we appreciate that as far as Kauai is concerned. We appreciate the transparency and the up-to-date information. But there's a lot of people throughout the state really that's concerned about the numbers, and maybe you can help us with that.
Sure. So one thing is I really want to credit the mayor's team because, of course, it's his team that puts out the press release daily. And because we work so closely together in the Emergency Operations Center and really are one team, and I get all of the information from my team quickly, and we're small and our numbers have been small. So it's relatively easy for us to, by mid-morning, put together the tally of all of the cases that we're aware of up to that point and give that information to the mayor's team and get that out in the press release. The Department of Health statewide is assembling data from all over the state. And in order to put everything together and make sure that the numbers are accurate statewide, they stop the data feed, if you will, at midnight and report everything for the prior 24 hours in the morning. So it's really primarily a matter of timing. But since the pre-travel testing program, another piece has been introduced that makes our numbers be different than the state numbers in a way that's going to persist. And if you look at the press release, we say how many confirmed and probable cases there are, and that's the same as the Department of Health reporting, although sometimes there's a lag in the state numbers catching up to ours. But the other category that we're reporting is people who have a pre-travel test, so they're tested somewhere else before they come here, but they don't get the positive result until they're here. Those cases don't officially count as Hawaii cases or as Kauai cases. They count as a case in the wherever that test was taken. But we are counting them in our tally of Kauai cases because they have an impact here. And I think we all think that that's important for our decision making in terms of what tier we're in and communicating accurately. Because people who are positive by the time they get here, they potentially expose people here. They use our Department of Health resources, and they certainly use our healthcare resources. So they present, whether this is your home address or not, whether you had your test here or somewhere else, if you're here while you're sick, it's our responsibility to see you through that illness.
So it's counted in our active cases
Yep.
on Kauai. So we know
Well,
when we look at active cases, it basically what that means is that that's the amount of actively positive people on Kauai at that given time.
exactly. That is what that is. The active number of cases is everybody who is subject to isolation, everybody who is contagious right now today that we know of.
Got it. Well, we appreciate that number because that's kind of the real snapshot. Regardless of where they took the test, the bottom line is they are now here.
If you're
and they are
here
positive.
and you've got it, we want to know, and we think everybody should know. Exactly.
Thank you. Thank you for that. I hope that clarifies a lot. I think it does. I mean, it clarified a lot.
Good.
So, Mayor, how's it going? I mean, we're looking at numbers now, and the other big question is, I mean, I've been getting a lot of messages. Hey, is the mayor going to shut us down? Blah blah blah. I don't know. Based on the tier system that was approved by the governor, maybe you guys can touch on that a little bit and try to clarify that for some of our viewers.
Sure, I'll speak a little bit about it, and then Dr. Berreman will probably have more to say about it. I'm deeply concerned. In fact, through this whole operation from March until now, my level of concern is at or near the peak of I guess a different level of concern that I had before, and it's because we're identifying big gaps in the pre-travel testing as far as safe travels. There's a number of visitors that get on a plane with or without a test. Some of those test results are delayed. So, the visitor lands here on Kauai, gets test result, and it's a positive. So that means that potentially close contacts on that airplane, potentially close contacts on island. And that sort of goes back to our square one, where we really pushed hard for a mandatory post-arrival testing program. And that is our position. And we're going to stand by our position. And we're going to continue to push the issue to the best of our ability. But at the end of the day, it's got to get the governor's stamp of approval. It's very hard to manage a pandemic with a one-size-fits-all cookie-cutter sort of solution. That has been our position from the very beginning. Our healthcare capacity is very unique in being that it is limited. It is limited. They may see us as rural, but we're very densely populated in certain areas and in certain households as well. So, I know that the concern is mounting, and I think an additional concern that we have is that when it comes to mask compliance, it seems as if our people are letting their guard down because our compliance level is, I believe, one of the lowest, if not the lowest in the state. National standards say that we should be at about 80%. Oahu has a higher mask compliance than Kauai, and we're somewhere in the 70-something% as far as compliance. With the holidays coming up, that's always a concern with Thanksgiving, Christmas, New Year's, and when you take a look at the epi curve on the US mainland, they're getting record numbers every single day. And so when you ask me the level of concern that I have, we are deeply concerned as a team moving forward, and our ability to stay in tier 4 is being compromised every single day that we get increased case counts. Now, I know that we submitted our rule with the defined tiers. I'm gonna have to go back and get a definitive answer if we have the ability to scale back a tier in less than the time period that was defined in our rule, because we have to have the ability to pivot quickly. And we have to also understand as policymakers and leaders that we have to have some flexibility built into our rules so that the decision makers can make quick decisions, because this virus moves very quickly. As you saw in Lanai, almost overnight, they overtook our island from 0 to, redlining it. So Dr. B, you had more?
You know me, Mayor, I've always got something to add. I have to say that I echo exactly what you said, Mayor Kawakami, which is that I've had, concern and anxiety sort of going up and down throughout this whole thing since March. And I would say in the beginning, much of our concern and worry was because of what we didn't know and what we couldn't predict. And now, at this moment, my level of concern and worry is, like you said, the highest it's been. And now it's based on what I do know and what we can see coming, because we can see the wave of disease washing across the mainland, the highest that there's been ever in the pandemic, the highest in the world, and it is spreading across all of the mainland. And at the same time, we have opened it to more easy travel between the mainland and here. We didn't know that when we started the Safe Travels program, that it would be at the time that disease would be peaking on the mainland. Nevertheless, increasing travel at a time when there's increasing disease and as we head into the holidays really feels like a recipe for disaster. And I think that the increases that we're seeing here on Kauai in the last 2 weeks are very, very concerning. And we can't, this isn't a time to let our guard down. And I have been on a couple of other calls where we were talking about how tired people are of all of our messages, of hearing our mayor and me and everybody say, wear your masks, keep your distance, wash your hands, avoid large social gatherings. We're all tired of hearing it and tired of saying it and tired of doing it. But we've done a really, really phenomenal job, especially here on Kauai, in keeping this under control very, very tightly since March. And a vaccine seems to be closer on the horizon than it's ever been before. And I think we need to motivate ourselves to keep up the hard work and not sacrifice all of the benefit that we've achieved from that when we're so close to having something that will really make a big difference.
I got a real quick follow-up question on the, what we're seeing on Kauai with the amount of travel-related cases coming in. Is the same thing happening on the other islands? We don't hear about it, and the people on the outer islands are not hearing about it. Are they witnessing the same type of positive cases coming from travelers?
Well, it's really easy for us to see here on Kauai because our baseline was basically 0. So we weren't having regular cases. We were having 1 or 2 every few days. And now we're having several every day, and it's becoming more and more. And we are contact tracing and investigating every single one of those. And until today, all except one of the cases since October 15th was travel related, meaning it was either a traveler or their direct close contact. And the one that wasn't was somebody who worked with travelers all the time in their day-to-day business. Today, we have at least one that isn't in any of those categories. It's just a community resident, and we haven't yet been able to make any connection to travel. And we haven't finished the investigation of, there were 5 new ones today. 2 are travelers, 1 is community acquired, and the other 2 we don't know yet, or I haven't heard yet. I'll be on a call after this to hear more about it. But that tells us that we are now, that's our first indication that we're having community transmission, independent of travel. And that's something we have not had since back in June and July. So again, that's very concerning, because that's the way that travel is a concern to us, that it introduces disease here that can then spread within our community. But I think that it's not having such a large proportionate impact on the other islands, because they had much more community transmission already, and the travel cases added on are relatively small. Here it's really easy to see because it's almost 100% of what we're seeing.
Thank
You
you.
know, I'm trying to find out from you, doctor, if those islands as well as Kauai, you know, like you said, we had a lower baseline, basically 0. And so now what we have on the other islands, are you saying that it's very hard for them to distinguish between travel related and community spread?
No, it's not hard for them to distinguish, but when they look at the numbers, they're still seeing many more community spread cases than travel spread cases. And so they remain appropriately most focused on their community spread, because if you have a very large outbreak that's spreading in a given neighborhood or a given community, and that's causing more and more cases every day, you need to control that. And when you're busy doing that, the travelers trickling in a few at a time aren't such a big impact on your total big picture.
Okay.
For us, that's
You know, last night we had mentioned this because I hear you very loud and clear. You know, the message has been, you know, mask, 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 and I think everybody got it. I think everybody got it. But yet there's still some of those who have masked and still got infected. So what we started to do was kind of like on the show at the end, we're talking about, you know, don't forget that, you know, you can pick up the virus by touching surfaces. We always talk about the how long it lives outside of the carrier. I mean, it may or may not be you know, be a point to consider, but yet it's still out there, because a lot of people have said, you know, my mom wore her mask. She was faithfully wearing her mask, but she still got infected. And I said there was a moment in time when she took her mask off, she could have transferred it to her eyes if she grabbed her face. So I guess the messaging needs to be one step further, which is mask, social distancing, avoid large gatherings, and disinfect every single step of the way to break that routine. When you're putting on masks, taking them off, always try to insert something in between. So hopefully, you know, washing your hands. So the thing is, but you're going to see a lot of times they only talk about social distancing, wearing the mask, and, you know, just avoid large gatherings. And I think for the most part, the complacency comes from the fact that, you know, I've been using my mask all the time, so I got nothing to worry about. But you still got to worry when you wear your mask, right?
Well, none of the things that we're describing is 100% effective. It's not like if you're wearing a mask, you can kiss and hug everybody. And staying 6 feet apart is good, but you should still wear a mask. So it's really the layered combination of all those. And unfortunately, nothing is 100%. I think I probably said that the last time I was on with you gentlemen. You know, very few things in life are 100%. The more we do, the better. I don't know if you remember the lieutenant governor being interviewed on TV shortly after he was diagnosed with COVID-19. And he said that he thought he got it from a long car ride with coworkers in which they were wearing their masks, but they took them off to drink their coffee, put them back on, talking, take your mask off to drink, put it back on. So I'm sure everyone in that vehicle would have said, yes, I wear my mask all the time. I wore it all the time. But we take it off casually, especially when we're eating and drinking. And those are times when we can share the germs as well.
So, Mayor, you folks are doing some surveillance testing now, free surveillance testing. I think it's called is it called surveillance testing, or is it called
Surge testing.
surge testing? Sorry, I know there's a huge difference. Sorry, surge testing. And we kind of wanted to get that out there and encourage people. So maybe you can talk about that as an amazing, awesome opportunity for people. So maybe you can share a little bit about that.
Sure, that's a program that Department of Health has deployed in partnership with the County of Kauai. When it comes to testing, we rely on Dr. Berreman and her team's expertise. It's every Sunday until the end of the year. I think are we using leftover tests from Oahu surge testing, or?
They are federally supplied tests. They came to the state from the federal HHS. And I think that there were leftovers after the Oahu testing, but I think that there was some additional supply brought into the state, but I'm not 100% sure. But it's been distributed according to population
Yep.
to each county.
And this is primarily aimed for visitor industry workers that have close contact with travelers, but it's available to anybody that wants to come down on a Sunday and receive a test. And it's good because, one, it provides that level of detection that we're looking for. Remember, we talked about the holy grail of managing a pandemic as far as the operation is prevention. Then it's detection, and then containing it through isolation and quarantine, and of course, treatment, being able to manage caseload at our healthcare system so that they can actually treat people that become sick. So this provides the detection component, but it also gives our frontline workers a good dose of real world experience, just in case we start to have a big event as far as community spread, that they have worked out all the kinks in the system, that everybody that's on the front line can operate the surge testing operation safely. And so it serves a few purposes as well.
Let me ask you this, Dr. Berreman, with regards to travel and someone inter-island travel. We have someone that comes in and they took their pre-test and they're negative, and they're still negative. And yet there's someone that's coming in from the mainland that arrives that transfers to a inter-island hop and rides on that same plane and is in close contact with this person, and their test comes back positive. Does that negate the person's pre-testing as negative, and now is asking that person, hey, you've been in close contact now?
So if a traveler, whether inter-island or trans-Pacific, flies during the period that they're contagious, we report that actually to the Centers for Disease Control, and they work with the airlines to identify who was sitting close enough to the person who's the case that they would be considered a close contact. And then they give us that information and we reach out to those people. So yes, if you, and at that point you have been actually exposed to a case and you become a close contact, and then you need to quarantine. And that quarantine is directed by the health department because of your exposure. So it's completely different. It feels the same, but it's for a different reason than the traveler quarantine.
Right.
So yes, you could, in that situation, still be subject to quarantine.
Okay, thank you.
Do you know offhand? I read somewhere that they notify passengers that were 2 rows in front and 2 rows in the back. Do you have any idea what their standard is as far as notifying the passengers that was on a flight that had a positive patient?
I know that they have criteria based on numbers of rows in front and in back and seats to each side, but I'm sorry, I don't have the specifics.
So not necessarily the entire flight. Not all the passengers will be notified. Okay. Well, okay, that was a question I actually had right here. So now you mentioned holidays coming up. I know it's hard to predict what's going to happen with the numbers, but if it stays, if I guess the question is, Mayor, if it stays where we are right now, if we get no more cases, then you don't see any restrictions being imposed. But if we start to, yeah, I know it's a tough question, but I'm trying to give the viewers some kind of expectation of what to expect rather than just drop the bomb at some point. I know a lot of people on our show have been calling for, hey, we got to lock it down already, lock it down already, lock it down already. And then others are saying, no, no, no. But I know you have your tier system. And I noticed in your press release the other day, you said if we had an average of one more case per day for 7 days, that we would drop to tier 2 and
3.
not 3. The press release said 2, or the newspaper article maybe was 2, but you meant 3.
Yeah.
Okay.
Yeah.
So at tier 3, you still don't opt out. Tier 2 is where we opt out, or you I guess go back to opting out of the testing, pre-testing opportunity. But at tier 3, what happens?
So that impacts primarily gathering sizes. So we scale back on gathering sizes, and then of course that also impacts the youth sports. Because that is would be under a defined gathering. So there's a lot on the line as far as moving from tier 4 to tier 3, which are trying our best to get out to the public that we're trying to avoid that. Of course, with what we perceive as the flaws in the Safe Travels program, and of course, we're gonna take those cases as ours, as Dr. Berreman has said, because it's honest. If they're here on Kauai, they impact our resources, they have an impact on our people, they are our positive case, and it impacts our ability to stay in the current tier. So that's the concern, is that it doesn't take much to move into the next tier. But over that daily, weekly average that we've spoken about, that would be ultimately what triggers us to move. But like I said earlier, I want to get a clear answer that if I feel that we need to pivot quickly, that we as a team on Kauai have the ability to make that call without being held up by a call up above us.
We saw that in Lanai. We saw where the residents of Lanai and Maui really were calling for the mayor to do the lockdown, but he had to get the governor's approval. And we understand things take time, but we talked about this on the show a few nights ago about how important we felt that it was to allow the mayors the flexibility to do what they need to do. So yes, I understand you need to submit a request, but golly, if something should happen, we believe anyway that you should have the authority to do what you believe needs to be done now and ask for retroactive approval, I guess. I mean,
Well,
because we're dealing with something that moves very fast.
yeah, and you gotta also understand that, and we don't want to get to that point, but if we have to get creative with our own restrictions that are under our jurisdiction and within our tool belt, then so be it, because this is a matter of public health and safety. And look, that is my top priority. I truly believe, and it's just culturally, and I come from the private sector, we've always had the mantra that you cannot have prosperity without health. And so it's very hard to have an economic recovery when we haven't stabilized the health situation. And if I'm proven to be wrong when all of this is done, I can live with that. But what I can't live with is the fact that we didn't give it our all to keep people safe. So, early on, we did things like beach park user fees, which can help to make things unappealing on Kauai. We had to do things like curfew. So we hope to not have to utilize those type of tools. We'd rather work through the channels and get a clear understanding and be able to express our position on the importance of keeping Kauai safe.
Let me ask you, both of you, in discussions with the other counties, we have many that travel inter-island travel daily. How are they handling that when they're traveling to, like, say they're from Oahu they need to travel to, say, Maui, Kauai, or the Big Island that requires pre-testing, and their travel daily is like 7 in the morning, and they return by 12. I mean, how is that kind of situation being handled?
So Dr. B can add on, but they're supposed to apply for a modified quarantine. So they're technically still under quarantine, but they're allowed to travel. They're required to physically distance and wear a mask at all times, but they're allowed to go to their place of work and then go straight back to their accommodation or straight back home and have everything delivered to them, much as if you were in a quarantine. But Dr. B?
I think a lot of it, because one was supposed to meet today, an individual who travels and he flies to the Big Island, and he received the permits from the Big Island because they needed a project to be built. So he went there, and he's there for like 5 hours because he oversees it, flies in and comes back. But he was just asking, how do we handle if I got to fly there? Because he doesn't stay on the island. He just flies in, checks, and then flies back. He says, yeah, and I think what spurred the discussion was that he tried to get a testing and none was available on the entire island of Oahu. But I understand there's more coming online now. But the question is, I'm pretty sure there's others in the same boat. They got to travel every day and not stay on the island, but come back. And they were asking, what, do we get tested? And by the time we get the test results back, we're going to come back home and going to be worth nothing already.
Yeah, so those same day travel type of operations, getting a test, I don't know, Dr. Berreman might be able to give her expert opinion, but just pragmatically, it doesn't pencil out as making too much sense if it's for a 5-hour trip, same day. But neither does, in my opinion, if you want to just call a spade, even the pre-travel testing program. Let me bring this real world sort of situation. A lot of Hawaii residents call the ninth island, their second home. And a lot of them go on just, weekend turn and burns where Pauhana Friday, they're flying out to Vegas for the weekend and coming back. So technically you could fly up to Vegas. Your first stop is, at a CVS, get your pre-test, then spend the next 2 nights just living it up, and then using that test result as your green card, well, not your green card, your green light back into Kauai. So that's some of the concerns that we have with the program. And more so, it gives people, in my opinion, a false sense of security. Like, government is supposed to keep people safe and be honest with them. And when you give people a false sense of security, they tend to drop their hands, and that's when they can catch it on the chin. And that's where I think the program has not sat well with me or our team up into this point and moving forward.
And I think a lot of people, we've had a lot of experts, medical experts on our show over the last few months, even up until last night with Dr. Capono and Dr. Ignacio. Great show we had last night. And that's the concern of the medical community, that in fact, your Vegas analogy or scenario is a common one. And it's the same if you're a mainland visitor that's getting your test 3 days or 2 days before. That gap between the time you take the test and you land here on Kauai, a lot of things can happen. And Vegas is a great example. And I know already a lot of people are going. Vacations Hawaii just announced that they're restarting their packages, which are very affordable. And I think we're going to see a lot of people, make those vacations. But I want to get back on the testing again. Dr. Berreman, I'm not sure who can answer this, but it was mentioned that they may have changed now, but early on that it was 2% of the arriving visitors that were opting to take the voluntary second test, and about 20% of the returning residents. Is that still the same, or are we seeing an increase?
I haven't looked at the percentages, but I think it's probably about the same. I did look at the numbers. We've tested just under 500, I think, returning residents. and just under 300 visitors since the onset of that post-travel testing program. And we've only picked up a small number of people who were sick that way. We picked up, I think, 3 total through those post-travel voluntary tests. We have picked up more through people who had their pre-travel test but didn't get their results till they got here. There've been 8 of those who were positive. So when the mayor says he has concerns about the pre-travel testing program, you know, if those results were actually available to the travelers before they arrive here, and some of those cases could be prevented from traveling, it would prevent the exposure on the airplane and prevent those people you know, them not knowing that they're sick as they start their travels or as they end their travels, because it's a mix of residents and visitors. And
we also got I know at least one, I think I read, where someone actually got sick, and that was how
and
it was.
yes, we've had others who had a negative pre-test and came here and did the voluntary post-test 3 or 4 days later and then got sick later. And that's because the disease has a 2-week incubation period. So you can still get sick up to 2 weeks after you were exposed.
And then real quick on the surge testing that we did one weekend so far, we did one Sunday. How was that? Was that a successful day? Did a lot of people turn out?
It was a very successful day. We had 160 some people pre-registered for the test, which is highly advised, but not absolutely required. We ended up testing just under 200 people. We do have capacity to do many more than that. So we are planning to do as many as 900 each Sunday. So we weren't nearly at that level, but we're assuming that word will get out and that participation will pick up. We didn't see as many people from the hospitality or tourism industry as we would like. So we're also continuing to do work to get the word out for that testing. But in terms of the operations, it went very smoothly. I was there all day telling people you collect this swab yourself. So I was there instructing people in how to do that all day. And it was a good event. It seemed appreciated. Everybody was nicely distanced. There were masks given away to people who were tested. It was a good operation. As the mayor said, it's good practice for everybody.
Now, with regards to the hospitality industry, has any of the hotels contacted the Department of Health as far as maybe asking for advice on how to, train their personnel, especially with the hotels opening up the way it is now? Because I had asked around if some have said they took some kind of training, and some said no, they didn't take any kind of training, and that's what scares me a little. That when they're going to start coming into that one-to-one contact, what do you do?
Well, there are industry standards for training hotel workers and providing them with, cleaning with appropriate protective garments, mostly just gloves and standard masks. The health department isn't able to personally train all of the hospitality workers, but it's an industry that has good, strong protections and materials out there. And of course, there are lots of things available online from the industry as well as the Department of Health and the Centers for Disease Control. And we're here to provide information and consultation as needed.
A lot of people have been asking about, and this is probably not for the two of you, but about testing. Have you heard if there's going to be any testing available at schools, at public schools? And again, this is assuming that the numbers stay at a level where we are still operating and not locking down, but statewide. But any word on that? Have you heard anything at the State Department of Health level if schools are going to be?
There's a statewide school medical advisory committee that is headed by Dr. Kemble, but that I've been participating in when I can. I haven't been at all of the meetings, but that's what led to the most recent guidelines for reopening for schools that give different levels of reopening with different amounts of disease activity. And this evening's focus of that group was working on school sports and how to safely reopen those and when. And I know that they have a break-off group now working specifically on that. There's also a group working on the testing issue. And some of the rapid tests that are coming into the state, a test called the Binax Now from the federal government, are intended to be used for educational settings. So we're working very closely with DOE about what that actually looks like, because of course the Department of Health, the Department of Education isn't a health entity, and they don't really want to be doing the testing themselves. They want to have access to having their staff or students tested as needed. And exactly what that will look like is still under development, but that and the school sports, I would say, are the two remaining top priorities.
Someone just posted, Dr. B, you need to be at all the DOE meetings. Real quick, and this is, again, people, this is totally unscripted. These two fine people don't even know what we're going to ask. So, we're trying to respond to some of the questions in the posts, as well as some other that we believe are related. One of them was we know we had 5 cases. You explained the 5 cases today. Surge testing was done on Sunday. If we have any positives that show up in those surge testing events on Sundays, do those get added into the daily count?
Absolutely. Well, one of the ones today was from the surge testing,
Okay.
and we're expecting that was a relatively quickly returned one, because those have to be mailed to the mainland. So that was actually the person who was tested got their results before we got their results, and they reached out to us, which is certainly, if you get a positive result and you have not heard from the health department, we welcome your call to the Kauai District Health Office. But we are expecting our first group of reported test results tonight, so we should see them tomorrow.
Oh gosh. Well, we hope and we pray.
It looked like a pretty healthy crowd.
Yeah. So I go take a test. I swab my nose. You guys deal with the test. You send it to the mainland. If it's a positive, I get notified by the lab, and simultaneously the DOH should be notified.
So you get an email, because you
Okay.
give them your email when you sign up. If you don't have an email, there is a website that you can go to check for your results. And then we also get what's called a batch report of a whole bunch of the lab tests, and those come into us once a day, not us here on Kauai, but to Oahu, and they get entered into the Department of Health's bigger system. And then the ones that are from Kauai get sent back to us, which is why it's the email to you with the result of your test is a more direct route than waiting for the batch to go to Oahu to come back to us. So
Okay, and if you do the surge testing on Sunday, you're not required to quarantine, correct?
no, what we do give out just a one-page kind of tip information sheet after you're tested. If you're just coming in because you're concerned, or your workplace is a place with lots of travelers, then there's no need for you to quarantine. But if you're coming in to be tested because you're not feeling well, or if you're coming in because you know that you were in close contact with somebody, well, if you know that you were in close contact, you should have already talked to us, so please call us. But if you're coming in for one of those specific reasons, especially if you're coming in because you're sick, then you should definitely quarantine until you get your results. But most people are coming in kind of just to check, or just to be sure.
Thank you.
Sure.
Mayor, what has the travel been like? The uptick on travel, has it grown larger than what's been expected, or is it kind of on pace right now with the amount of travelers coming to Kauai?
I'm not too sure if it's grown more than what was anticipated. I'm not sure about that. Maybe Dr. B knows. I know somebody in our team would know. Sue Kanoho would definitely know. I do know that I think it's up to maybe 1,200 people. I think that's the number I recall hearing coming in daily.
Mhm.
Yeah, I think it's about 1,200 a day, and about, I want to say 17 or 18,000 total since October 15th, but I'm not clear if that includes just inter-island or just trans-Pacific, or if everybody's mixed in. I know it's not just inter-island, but I don't know if that's everybody or not. And what we anticipated, for me, it was really hard to know what to anticipate. Frankly, this doesn't seem like a time to go on vacation. So it's sort of unfathomable to me that people are choosing to travel recreationally in these times. On the other hand, we've all been under a lot of strain and been really cooped up for a long time. So,
Well, based on the you talked about it earlier, the widespread of this virus, especially the graph they put up today on a lot of the major news organizations, where the continental U.S. is just all red, all red. I mean, maybe the bright spots is like Kauai, and there was two other places on the map, but the rest are just all red. And I think with the fares that's been offered, yeah, I would have to say, I mean, this is just a wild guess. A lot of people just want to escape from the virus,
Yeah.
they,
No, I
because
think you're right, Charlie.
I think it's something to be afraid of, because something as simple as a discussion at a meeting of maybe 10, 15 people, and out of the 10, 15 people, 13 of them get the virus. I mean, that says a lot. It's almost like a cutaway in time, right? Kind of show you what's happening.
Yeah, keeping Kauai safe is a double-edged sword, and that's the thing. It's almost for a lot of people, it only hits home when somebody they know or are very close with gets impacted severely, and then it becomes very real. But I tell you, uh, I go out with my wife and daughter occasionally just to holo holo, and I get stopped numerous times by people that are asking me, and I have a mask on if I'm the mayor, and when they find out I am, they're asking for a picture, and I get to having a conversation with them, and they're visitors, and many of them have traveled here exactly for that reason, that they feel Kauai is safe. They've been watching our COVID-19 updates. Some people have actually relocated and moved here because they feel that Kauai is a safe place, not understanding that every time somebody jumps on a plane to seek refuge, they potentially bring in harm onto our island. And so it's a double-edged sword, keeping an island safe. I can tell you that our team, the behind the scenes folks that most people will probably not see, have been working tremendously hard for months upon months to keep this island safe. So although they may see my face and Dr. Berreman, there's a whole team of people with families that have made sacrifices, that want to travel, that have not traveled, that want to gather with their friends, but have not gathered, that work 7 days a week, that are on call 24 hours a day to keep this island safe. And so it hurts my heart to see people throw caution to the wind. And I'm speaking about our very own people, that we're working hard to protect, that can at times be reckless with their behavior, because there's a whole bench full of people that have just committed their whole life to keeping this island safe and guiding us through this very challenging time. So I just ask people that they keep those hardworking folks that are behind the scenes in mind, because we're asking everybody to make some sacrifices. And I know it's hard. I know people are frustrated and they're getting fatigued, but if there's one plea I can make is just, don't do it for me. Do it for your neighbor, do it for your family members, do it for yourself, do it for the kupuna, do it for those other folks that may not be as blessed as we are to have healthy immune systems, although we don't know how this virus reacts, because it's almost like Russian roulette.
Yeah, and we appreciate your team over there, and I think the whole state. I gotta believe the whole state now knows, and are very envious of our Kauai team, and we see it every night in the comments, and it's a good thing. But I did want to echo your message about our own residents that are out and about taking chances. I made a plea the other night, said, please, if you guys are going to do it, don't post the pictures on Facebook. Don't, it infuriates me when I see people that I know that totally violate social distance and the mask rule, and they're taking pictures and posting them on Facebook about, having a wonderful day at the beach or at someone's garage. But why would you do that? Why would you do that? I don't know. And when I see those pictures, I get very upset, and I think a lot of people do. And come on, man, we gotta get over this. Um, I just had a question. I tried to register for testing in Hanapepe, but the website says no locations in your area. Has testing in Hanapepe been canceled? Are you aware of that? Is that where
It's
the next testing is? It in Hanapepe?
this week Sunday is in Kapa'a, and the following Sunday is in Hanapepe. So it may just not be open yet.
Okay. Well, you got that. Maybe check next week for Hanapepe.
Yeah, the dates and locations are on the county's website.
Okay. All right. I'm just trying to.
Someone's asking this question. It says, will Mayor Derek Kawakami and Dr. Berreman propose that a shortened quarantine of 5 to 7 days with a second test to clear is recommended? I mean, she wrote that, but I don't know what they're getting at.
I think it's kind of reprising the proposal that the mayor had submitted. When was that, Mayor? Time is kind of all blurring together for me. But when the Safe Travels program was first talked about, the mayor submitted a proposed rule to have people who had a negative pre-travel test still quarantine for 3 days and then get a test after those 3 days in order to get out of quarantine. And I know that our medical experts, and I consider myself a medical expert, would prefer that that be 7 days if it can't be 14 days. And from a purely health perspective, that absolutely and incontestably makes more sense. But a 3-day quarantine with a mandatory test at the end in order to get out of quarantine seemed like a reasonable compromise in order to allow more travel, more visitors, more economic activity, while also introducing a greater measure of caution than just the pre-travel test by itself. So I think the question is, and that proposal was one that the governor did not agree to. And I think the question is whether we're going to revisit that. And I think that's in the mayor's hands.
Yeah, and we will. And originally when we proposed, I think that was Rule 18, which was the mandatory post-arrival test. One of the concerns is that, the concern back then is they didn't have a program for inter-island travel for our very own people. But since it became almost infuriating for our local residents that mainland visitors had the ability to take a test, travel to Kauai and run around, and our own people didn't have that opportunity, they very quickly contracted with local trusted testing partners. And so now they're testing on island. So we believe it's feasible that you could utilize the existing trusted testing partner to also deploy the post-arrival testing program and pass that cost on to visitors. I know the more testing we can do, the better. But if I had to choose one, the 72-hour pre-travel or the 72-hour post-arrival, of course I would choose the 72-hour post-arrival if it becomes a matter of cost and convenience to mainland travelers wanting to come in.
Dr. Berreman, a question that has risen several times. It's the term used, the trusted testing partners. Okay, what's the thought process that goes into selecting them? Because there's one, we had this thing and it was aired the other night, but it wasn't. I said, hey, somebody copied the post that I put up because a veteran had asked me that, I get all my benefits free from the VA, but I can't use the test results because it's not on the list. And so then the discussion came up. He goes, a lot of medical professionals in the state, there's a lot writing, but yet there's only like the big stores like Walgreens, Walmart, CVS, Kaiser, that's part of for locally for the testing partners. And why aren't other places like, example, like Doctors of Waikiki, they have a lab, they got clear clearance and all that. And I didn't know what to say. I said, for me, if I am entrusting my doctor to go and take a test from like HHSC and use their labs, but yet it's not on the trusted partners. Well, what's your thought process on that?
Well, so I wasn't involved in the early genesis of that. I mean, that was really early on, was the lieutenant governor negotiating with large firms on the mainland to try to have some confidence that we would know that the testing that for travelers came from legitimate and licensed labs. I think that the flaws that you point out, especially as we're using it for inter-island travel and travelers coming from the mainland from more remote areas, we're finding that there aren't enough. And I know that the AG's office is getting ready to release a list of added testing trusted testing partners, I think early next week. And I would anticipate that list will continue to grow. The major commercial labs here in Hawaii are trusted partners. So, your doctor may collect the swab for you, but if that swab goes to Clinical Labs of Hawaii or DLS, then it is a trusted partner. But we were very aware that there are still barriers.
Yeah. Well, it's just that we had several that they actually went to doctors because we had Tony Traposky on, and even though he has his lab, but for any other thing that needs to be tested, he sends it out. I believe he uses diagnostic, right. But because it was his, I guess, on the paperwork, that's part of the trusted partners, because he wasn't on that paperwork, even though they're the ones that did the reading, and he just collected the samples.
Ironically, government-run public health laboratories are also not trusted partners. So that's something we would like to work on, but there are so many of them, and each one is separate nationwide. It's literally hundreds, if not thousands. So it's a challenge.
Wow.
Yeah, it would seem practical to allow any certified lab that is licensed in the state that they're providing the test, and if the test is a qualified or certified test, that it would work. I mean, I think that's a huge problem right now, where you're getting people driving hundreds of miles to go get a test to avoid a 14-day quarantine. But I would agree with you, Mayor, that if I had to pick between the pre and the post-arrival, I would definitely take the post-arrival test. I mean, we're seeing now that how flawed the pre-travel can be, and it's unfortunate.
And I would combine the post-travel with quarantine until that post-arrival test is obtained.
Absolutely.
Because that's the piece that protects us in those intervening days. And also that means that issues about enforcing a mandatory test 3 days after you get here, it's not hard to enforce it if it's your ticket out of quarantine, but it's hard to enforce it if your option is going to the beach or zip lining.
Yeah, we know the whole issue with the quarantine, the mandatory quarantine with the post-travel testing and the Lieutenant Governor said it here on our show, that it would limit the number of participants in the Trans-Pacific travel. People wouldn't come, and that wasn't the objective of the Safe Travel Plan. The Safe Travel Program was to encourage Trans-Pacific travel, and that would have been an impediment, and they chose not to do it. So I understand. I mean, it is what it is. It is done, and now we move forward, and it's unfortunate because we're starting to see, and my fear, Dr. Berreman, and you can, I'd like to hear your thoughts, and I'm running out of time, but do you expect the numbers to change as not just travel, but with the holidays and all these different events where the congregations are happening, the gatherings? What do you expect? What is your outlook on this?
I think that Kauai has looked different than many other places because we have been protected by our borders and by the travel restrictions and travel quarantines. And we have, under the mayor's leadership, taken very aggressive action very early. But there's nothing different about the biology of the virus here and the people here than anywhere else. And we can't expect that it won't behave the same way here. I have too many negatives in that sentence. Yes, I think the disease is going to increase, and I think it's going to increase at an increasing rate unless we are able to tamp down the daily introduction of disease to our island. And the travelers are not just visitors, they're also residents. And to me, that's the hardest thing, because I know that, I mean, some of our residents may be traveling for leisure, but many are traveling to see family and friends on the mainland whom they haven't been able to see for a long time. They're going for reasons beyond, as you said earlier, Charlie, escaping to paradise. They're going to fulfill obligations and to take care of loved ones. And yet when they come back, they pose a risk to us here and to their families unknowingly. So yeah, we're in, you asked earlier if we were worried, and we are. And I think we're in a very precarious position.
You know, there's this mindset, you know, going back to the very, very large Black Lives Matter march on Oahu, over 10,000. And yet it seems like there was not one case that came out of that. Was that just a fluke, or
I haven't looked at data for that, so I don't know, but you know, we're Hawaii, it's outdoors, you know, there's a lot of space, there's good trade winds all the time, so we're a little bit different environment than a lot of places on the mainland. And we know that the disease is spread more by close contact and being in places that are less well ventilated. So as we, you know, our weather doesn't get cold in the wintertime, but it rains more, and we may be more inclined to be indoors and to be closer to each other for longer periods of time and take our masks off because we're eating and drinking together. And those are things that pose risk. And then if you introduce into that people who have traveled to the mainland, where, as I said in the beginning, unfortunately, disease now is higher than it's ever been. So the risk of that travel is higher than it's ever been. And our defenses are lower than they've ever been.
Yeah,
and that's not a good recipe.
That's the scary part. When you lessen the travel restrictions while the disease is on the increase, that, like you said, it's a recipe for disaster. Mayor, I know we right up at the 8 o'clock hour. We did want to talk about the how can people apply for the surge testing. I know it's on the county's website, but is it that same website? Do I need a COVID?
Do I need a COVID-19 test.com, I think.
Yeah, that's the one. Do I need a COVID-19 test.com? People, listen, especially those of you in the hospitality industry, that means airport, that means cabs, Ubers, restaurants, hotels, all of you, please, please, please take the little time out of your day on Sunday and go get a test. They can handle 900 a week, a Sunday. So please, Charlie called me up one day and he said, Mel, you know, why don't we get the mayor and Dr. Berreman on and we can help promote the testing. From day one, it was always the experts' point about they really stressed the fact that testing was vital. And then we went through that phase where you couldn't get tested, and we heard the uproar. People said, yeah, my doctor not like me. My doctor not gonna sign my paper. You gotta be dying to get one test. Blah. Okay, now you don't need paper, you don't need insurance, you don't need, all you need is make an appointment so that you don't cause a problem on there. Just make an appointment and go get a test. Please, I beg you. Okay? No complain.
no, you know why they're complaining, because when they show that slow motion of that swab about this long going into the nose and coming out of the side of the ear. I think that's what kind of freaking people out. But I think what Dr. Berman said, the self-swabbing when they administer their own, yeah, it's
Say
they
of
can.
all the people I helped self-swab, the worst side effect was it makes some people really sneeze. It made one poor young man sneeze so many times he was practically in tears just from the force of the sneezing. And then another lady sneezed a lot. But other than that, everybody was fine.
Okay, folks, you heard it. Self-swabbing, it's okay. You're not gonna put in that swab and tickle your big toe at the same time. It's not gonna happen. You're gonna do your own. So don't you worry. Don't you worry.
All right. Well, it's 8 o'clock. We thank you guys. Dr. Berman, any closing comments for our viewers? Now is your chance. Let them have it, Doc.
I would just encourage people to keep up being strong and being safe through the end of the year into next year. I think we're going to have a vaccine available, probably not until the early next year. I don't know when. I don't have a crystal ball. But stay strong, Kauai. We've done a really good job and we can continue to do it. It's a long, hard road. The mayor and I are in there with you. You were talking about our team earlier. The team is not just the mayor and me and all of the people doing the work. The team is every single person here on Kauai who's been doing their part since March to keep us safe. And we can keep it up. We just need to stay strong a little longer.
Mr. Mayor, you have a captured audience.
I know we all feel a little captured with all the restrictions on freedom. I want to take this opportunity to once again thank you, Uncle Charlie. Thank you, Mel. Thank you to all the people that took time to listen in. And I want to take this opportunity to thank our veterans. Yesterday was Veterans Day. It looked a lot different than Veterans Day in years past. But yesterday, as I reflected back on the tremendous amount of sacrifice that our veterans have made for our freedoms, it puts into perspective what we're asking people to do as far as making sacrifices moving forward, to wear a mask, to try their best to avoid large gatherings, to do their best to, physically distance. And these are the very people that we're trying to protect. A lot of these veterans have underlying health conditions. They're elderly in age. As you saw, the care home, the Veterans Care Home on the Big Island, it was tragic. And, I recently had a conversation with a very close friend who, told me, look, it's going to be a long haul because government keeps on intervening on the course of this virus. It needs to run its course. And I told him, look, I understand that school of thought, but I can almost guarantee you, because I know you as a caring person, that if you were sitting in the seat that we are sitting in, you'd be making the same calls, because the amount of responsibility that's put on our shoulders as far as keeping the island safe and not being reckless, I think most people would be doing exactly the same thing that we're doing. Dr. Berreman, myself, our team, which includes all of you, we're nothing special. We just have an underlying care for people, even complete strangers. And we're going to do our best to protect everybody. So thank you.
Thank you.
Arlie?
Well, as always, I first like to take this opportunity to thank our two guests tonight, the Honorable Mayor Derek Kawakami and Kauai District Health Officer or Health Office Dr. Janet Berreman. Thank you so much for joining us. To our viewers out there, there's a special person I'd like to recognize. She was behind the scenes from the mayor's team tonight, answering in responses in helping us answer your questions. And that's the lovely Sarah Blaine. So we like to say mahalo to Sarah for chiming in, and as well as Mike Dahilig for always answering the call whenever I place the call. Folks, even though things may seem really bleak at times, just know that in each county, I'm pretty sure each and every administrator, county mayor, they're trying their best to fight this thing. I look back, yeah, I took a lot of hard shots at the governor. I took a lot of hard shots at the lieutenant governor, because when you get into positions like that, you got to expect that. But now's the time where now, if we're asked to, step up to the plate and do what is responsible to ensure our own safety, and now's the time. Now's the time, that because this virus is moving very, very fast. It is moving very, very fast. We do have one advantage, and that is we're in the middle of the ocean, so we have that border. Let's use it to our benefit. Yes, it will come in. There's no denying it. It will come in through travelers, but I'm pretty sure travelers are not negligent. It's just that innocently it will come in with them. So once it's known, once it makes ground zero and touches down, we have to do our part in staying away from it until it suppresses and goes away. So for now, we have to do a little sacrificing, because put it this way, as much as you want to hug mommy, daddy, grandma, grandpa, just think about that you won't have that chance to hug your grandma and grandpa, because once they get sick, you cannot go in the hospital and visit them. You will not be allowed. Okay? So let's lay out the facts. You can have grandma and grandpa, mommy and daddy around for a long time. Okay? Us who have lost a loved one like my brother, I know he was by himself. And I can only imagine what it was like when he was by himself. And you don't wanna be in that position, gang. So all I'm asking you is, let's do our part so we can have our family around with us. We can see them. Okay, we can see them. Don't be selfish, because once that virus tags them and they can't fight it off, they're gonna be by themselves. Okay, so thank you very much. Hope you take my advice. Hopefully, brother Mel.
Thank you, Charlie. Thank you, Mayor Dr. Berreman. Amazing. We're honored. We're honored. Two knuckleheads that come on every night, and to have the mayor and the district health officer with us is just amazing. And I gotta tell you, and I'm not sure if you guys are monitoring the comments or not, but if you're not, please do later, because a lot of appreciative people. I did want to echo, Mayor, and all of you, about your team. Your team is incredible. Sue Kanoho is another one. She did
Yeah.
clarify in her post that the numbers that you stated were Trans-Pacific and Inner Island. I wrote that down. I forgot to say that. So that is the total number. And then Sarah Blaine, I gotta say, Mayor, she has stopped so many rumors on our island, because I feel sorry for her, because I get all the information or the rumors or what people saw or heard, and I let her know. She checks on it, and within minutes she'll get back to me to clarify, and then I'm able to go out and let the people know that, hey, toss that out. It's not even true. So I just wanted to say, and I know there's many more in your team, that when this is all said and done, Mayor, Charlie has volunteered to host a huge luau at the stadium for all of us, free of charge. And so, really, the transparency, the openness, the honesty, the truth, I think tonight the people appreciate that. I know I do. It just puts us in a much more comfortable place, because it makes us feel like we're all in this together, that we all have a stake in this, and that you sharing this vital information, both of you, allow me to at least program my head to say, we can make a difference. We know the facts, we know what's happening, and we feel like we're part of the team, and we appreciate that so much. And I think I speak for most of, if not all of our viewers here tonight. I just want to, do I need a COVID-19 test.com? Please do that for our community, and wear your mask, wash your hands, social distance, and stay away from the huge gatherings. All right, people. We love you guys again. Mayor, Dr. Berreman, thank you so much. We're gonna let everybody go now because it's late. Thank you for staying with us the extra minute. Tomorrow night, 7 o'clock, everyone. You guys all stay safe. God bless. We love you guys. Aloha. Come on,
Thank you
Dr.
so much.
Berreman. Hey, no, you gotta put them up. You gotta put them up, because this is the one we're gonna release to CNN tonight. Yeah.